At his primary victory party last week, Governor Kevin Stitt said Oklahoma would be a leading force in helping and protecting expectant mothers and their newborns during and after the mother's pregnancy. But how would that work? And are programs in place to achieve that following the reversal of Roe v. Wade? Kennedy Sepulvedo joins us with more on that. Kennedy?
Jason, I spoke with the Oklahoma Healthcare Authority about a few programs that assist expecting mothers in Oklahoma and a mom who has used state services in the past while raising her 2 children on her own.
I microwaved macaroni and cheese before I left work.
Jennifer Davis is in the hustle and bustle of life as a single mom, and in order to get her daughter Brooklyn to gymnastics on time, dinner is served in a to-go cup. The Moore, Oklahoma mother raised both children alone while putting herself through nursing school and college.
I had a 2-week-old baby, and he threw a hammer at me with the baby in my hands, and I dodged the hammer, and it broke the glass window behind me. From that point on, my baby was 2 weeks old, and I left the father to be a single mom.
That baby, Dylan, is now 24 years old and has never had a relationship with the man who threw the hammer at his wife and newborn son. When Dylan was 16, Jennifer got pregnant with Brooklyn and was once again left to raise the baby alone. Single parents can receive child support from their co-parents, but for Jennifer, those checks were sparse.
My lowest check was 7 cents. I think his balance is close to $150,000 is what he owes for my big kid. Now, just because he turned 18, it stops accruing, but he still owes the debt. My little, I filed child support. It took me 3 years without an attorney to get it approved through the state.
Governor Stitt announced at his primary election party that Oklahoma will love the mother and the child.
We're going to be #1 in the country at supporting pregnancies and mothers, and that's kind of my commitment to the health care in Oklahoma.
The 2022 Wallet Hub ranking for best and worst states for women ranked Oklahoma as 50th in economic and social well-being, 50th in healthcare and safety for women, and 51st in women's overall well-being. The latest ranking for children's well-being ranks Oklahoma as 33rd in economics, 42nd in health, 45th in education, and 42nd in overall well-being. Oklahoma has some programs in place to help women who are both pregnant and new mothers or single mothers. For example, the Oklahoma Healthcare Authority's pregnancy services are available to Oklahoma women and girls who are expecting.
It would pay for her physician visits through either primary care or specialist through an OB-GYN. Pays for the labor and delivery costs, the ultrasounds.
To qualify for those services, a woman must make less than $18,084 a year for a family of 1, $24,360 for a family of 2, $30,648 for a family of 3, and $36,924 a year for a family of 4. Jennifer used TANF, or Temporary Assistance for Needy Families program, to receive financial help after her first child was born.
It was kind of like a child support check, if you will, and some food stamps. I've even got daycare assistance, but the way the co-pays or whatever worked with daycare, I still couldn't afford daycare.
The help was short-lived. Jennifer finished LPN school and got a job. She no longer qualified for assistance.
There were times that I couldn't pay my gas bill. I would put mine too, put his bowls of water in the microwave to heat up the water warm enough to take a bath because I didn't have enough money to pay bills with.
Another available service is called Soon to Be Sooner Services.
So it's not as robust of a benefit because the benefit is only for the benefit of the child, and it's available to the pregnant mom while she's carrying the child. So there's no postpartum benefit there.
The income threshold is higher for the children's program. A family of 1 can have an annual income of $28,560. The annual income qualification goes up roughly $10,000 for every additional person in the household. Women, girls, and families fork over big bucks during pregnancy and delivery.
Our bill, of course, is, in the neighborhood of between $2,000 and $2,500 just for the doctor care. The hospital, I think, can easily be $10,000. Sometimes there are complications. We have occasionally patients who are in the hospital for extended periods of time, health issues or pregnancy-related problems.
We use nationally set standards for a lot of our rates, including the labor and delivery costs. Now, I'm sure that a lot of our providers would probably hope that it would be a higher reimbursement, but so far it has been adequate to make sure that we can ensure access to those services for all of the moms on the program.
While costs are a worry for some, Dr. Stone, a practicing OBGYN of 25 years, is concerned with women's health.
I don't think anybody likes the idea of their doctor's decision-making process being influenced by a 10-year prison sentence and a $100,000 fine as you know, they're telling you what your medical options are.
And if you're going to hold a woman legally responsible for that, a man should be just as responsible.
And President Biden signed an executive order that is aimed to protect abortion access. The executive order does not safeguard access to abortions nationwide, but does mitigate potential penalties women could face for seeking an abortion.